Welcome back to Hyperbaric Living Podcast. I'm your host, Dr. Masha, and today I have with me Dr. Paul Anderson. He's a legend in the world of naturopathic medicine. We all learned from you. Somehow you taught different courses for most of us naturopathic doctors who graduated in North America. And today we're going to talk about autoimmune disease. It's been a subject of mine. As you know, I suffer from autoimmune disease that really went bonkers after I had COVID last time. And of course, it's a personal interest of mine. And I've had a lot of requests from listeners from our audience to produce an episode on autoimmune disease. So I decided to speak with Dr. Anderson because he knows the subject really well, and hopefully we'll get a lot of insights today. Welcome to the show, Dr. Anderson.
Thanks for having me.
I'm really excited to have you. So let's dive in. Let's start with autoimmune disease.
If we make it as simple as possible, autoimmunity is exactly what the name says. It is some part of your immune system has gotten off track and it's doing the right thing in the wrong place. So instead of maybe attacking an invader or helping you modulate your immune function for infection or healing, it's decided a part of you or parts of you are the enemy. And this is why there are so many types of autoimmunity. Now, there are some that are much more common than others, but the real problem is that once your immune system gets the idea chemically that a piece of you or pieces of you are an outsider or the enemy, they will start to make antibodies and other inflammatory chemistry against that part of you. So if that's a part of you that's, say, all over your body, like the joint linings, you can get a autoimmunity that affects you there. If it's your digestive tract, you can get autoimmunity that affects you there. If it's many parts of your nervous system, a lot of autoimmunity there. One of the most common is Hashimoto's thyroiditis, which large numbers of people have. And there's, as you said, hundreds of others now. So that's the simplest way to think about it. And what I have seen over and over and over the last many decades of doing this work with patients is there's two categories that generally in the immunology world they don't really talk about because they just see it as one disease. One category is what we always hope to be able to affect, which is what I call more of a functional autoimmunity, meaning if we catch it earlier in its process and we fix all the reasons it became an autoimmune process, we can either minimize it and keep it quiet or maybe even have the markers go away. And I've seen that literally hundreds of times. There are also people then who have the second type, which is possibly, and I think in modern times, what we know more genomically, genetically determined, epigenetics get turned on. And that's a lot harder to reverse. Like it's maybe going to be there the rest of your life. And it can be modified to a lower level, but it will always be there in the background. The problem is there literally is no way to know which category you are in until you start to work on these things. And that's why I always counsel patients is, it doesn't hurt to try. And even if you have the, second type I talked about where it's kind of hardwired, everything we're going to do will still be helpful over there. So, but I have literally seen, especially my chronically ill and post-infectious patients, at least 100 or maybe hundreds of cases where their autoimmune markers, when we got the rest of their body working well and their immune system less activated, the autoimmune markers went away.
So let's say a person got diagnosed, whether post-COVID or they just received a diagnosis of autoimmune disease, because again, sometimes it's not very obvious and it takes time to get the diagnosis. Where do you usually recommend? What would be the direction of the treatment, and where would you recommend that their treatment starts?
Yeah, so one of the things then, once we kind of get past that first conceptual idea of really there's two types of autoimmunity that look identical, but maybe we can modify them differently, although the treatment is the same. What I have seen over and over, and this is actually very clear in the research around autoimmunity, is there are categories of problems, health problems, that are very likely to trigger autoimmunity for people, but they're different for each person. So what I always tell people in the beginning is let's take a step back and let's assess the core areas that we know lead to autoimmunity, the areas for autoimmune dysfunction that I look into. The first area actually are toxicities, and this is in the literature, whether it's metals or chemicals or mycotoxins, very common with mold toxins. So toxicity is an area that at least has to be looked at. The next is your immunology overall. So that means, okay, how bad are the autoimmune labs? Are they really high, or are there a lot of markers that are just above normal, but there's 3 or 4 of them? Kind of different pictures there, but that's how we follow it. But that's the effect. The rest of your immunology, though, the big triggers, and this again is in the literature pretty well laid out now, is chronic infections, either one that you recently had, such as COVID, or chronic infections that are reactivated, or they're just in your system kind of running behind the scenes. You might not notice them anymore. And that comes from a number of reasons. So the chronic infection piece includes resistance factors like biofilms and other stuff. Toxicity makes chronic infections worse. The next part that people sometimes don't think about, but is hugely important, are your hormones, the endocrine system, because they are maybe less likely, although they get involved in some autoimmunities, there's less likely to be a direct cause like toxicity or infections and stuff. But your body uses your endocrine, your hormone system, to rebalance when your immune system is challenged. And what we're seeing now in our long COVID patients is exactly what we see in our other post-infectious patients that are hard to treat. And that is that the hormone system has been responding to this problem, and it gets out of balance too. Well, as soon as the hormone system goes out of balance, it reinforces the drive for autoimmunity and other balance problems. The next area that doctors like you and I always talk about is the digestive system. It's a huge area too. And what I'm seeing a lot in your post-COVID patients is the immune disruption maybe either accentuates or turns on more chronic inflammatory digestive problems. We're seeing case reports of bacterial overgrowth syndromes, fungal overgrowth syndromes, parasites, all kinds of stuff going on. And again, it's more that the infection opens the door to that. But if you think about it, your digestive tract does, obviously, it helps you get nutrients out of your food, but it has its own nervous system, it has its own immune system. So if it's all not working correctly, it's going to feed into this as well, just as much as a systemic infection would feed into it. And what's interesting is a lot of folks may have no symptoms of digestive problems, but it'll be really out of balance. And then there's other things such as, your cellular milieu, if you will. Have your mitochondria been damaged or injured through the infection or the cell membrane? And the problem there is that if you don't kind of get them back working correctly, that is a big area, especially the cell membrane getting damaged.
Do you recommend to do the full panel testing, to test for mycotoxins, test for heavy metals, look at stool testing, infectious disease testing? Because that's going to be a lot of testing. Is it worthwhile really go after that and do all the testing?
I will usually have them put their effort and their financial, costs, because the labs, generally are not free, into toxin testing that does include urinary screening for metals, chemicals, and mycotoxins. So that's especially if there's autoimmunity, I think you have to rule that in or out very early, because they can just keep you treating stuff forever and ever. I believe equal to that on the first round are some of the hormonal things to look at.
Thank you. That was that was really detailed, but it gives a really good idea of where to start and what to do next. So let's say we get all these diagnostic tests. We look at them and we start our treatment. And from what I understand, our treatment will be directed. First, we're going to treat the root cause, whatever that is. But we also want to help the patient in the moment because they came with the symptoms and they want to see the symptoms relieved. Yeah. And that's where bringing down the inflammation, which is a hallmark of autoimmune disease, comes very handy.
We still may start with very gentle treatment there just to get your body going towards the healing direction, because we don't want to blow you out of the water, physically and make you sicker. Those would include things such curcumin is very good there, boswellia, another plant. There's a lot of nutrients. There's some things, like pregnenolone that are helpful, omega oils. And this is an area where usually we start to talk about, let's synergize these things with hyperbaric therapy. On the micro side, all this anti-inflammatory stuff, that's all going to help. But then we may do specific things to kind of help the membrane and the mitochondria heal up. So again, the omega oils you're doing for, for the neuroinflammation, going to help there. Specific nutrients like CoQ10 and alpha lipoic acid, things like that, that help the mitochondria a lot. Many mitochondrial supports. So usually if we're working kind of on both of those angles, from the micro up and the macro down, a really wonderful thing, and we do a lot of hyperbaric as well, is hyperbaric synergizes both processes. So whether it's the inflammatory deregulation globally or the cell damage in the mitochondria and the cell membrane, it's helpful in both ways.
Excellent. So you mentioned hyperbaric oxygen therapy, and that got me really interested because I've used hyperbarics personally in my recovery from autoimmune. I had psoriatic arthritis, really bad, antiphospholipid syndrome, some other stuff going on. And I find that it really helped. I didn't have any protocol. I was my own physician. So I tried different things and I tried to assess and see how I felt. But you are treating a vast number of people. Do you find that there is a specific hyperbaric protocol that works well for autoimmune patients?
What I tell people is, look, this is a tool like anything else. And what we usually do, say with supplements or other things, is we always start small and work up to see how you respond, right? Because some people, a little bit, does great. Other people, constitutionally, this is how I am, a little bit does nothing. I need like enough for a large animal or something like that before I feel it. Mm-hmm. Same with hyperbaric. So what we tend to do, especially if you're really not feeling well and we know there's autoimmunity in the background, or maybe we don't know, but you're just so sick, we look at it. If you've never had a hyperbaric, I tend to recommend you start in a low pressure system and see how that feels to you. And what we normally do is sort of walk the person up in intensity. So I usually start in a lower pressure system, like a 1.3 atmosphere on room air. And we usually, and this is almost never do we treat at this length, but usually our sensitive folks, we start 30 to 45 minutes. But let's just see how you do in there, right? The next treatment, though, if all went well on that first one, and you didn't really, feel much change after, we'll usually go to 60, maybe 90 minutes. We'll add supplemental oxygen, and then we'll see what that does for you, And I always tell people, usually by the third or fourth treatment, because then we're into some, meaningful treatment length, we'll know if this is going to be kind of, hitting the middle for you, right? And something that is, people like you and I talk about it, but in the bigger hyperbaric community, because it came from very linear and focused therapeutic protocols for dive injuries and trauma and things like that, where you really need super high pressure and Navy dive tables and all that. That's sort of one area of pressure medicine. In what we do with people who are chronically ill or autoimmune or post-COVID or whatever, you have a different sensitivity. You're not treating them for the bends. You're trying to get oxygen into their cells and do all the good stuff. So what I tell people is, because we're going to do all these other things to support your mitochondria and your antioxidant status and inflammation, et cetera, what we find, and I've even presented a case report on this at one of the national hyperbaric meetings, is if you do those things and you do hyperbaric, you often don't need as much pressure, as much oxygen, or even as much time sometimes, although that depends on the person. And so we always do them as a synergy. I have personally never done hyperbaric as just a one, treatment without doing the other stuff. So I would say yes. There's a lot of people where they do the first 2-3 trial things and we step them up, and they're like, I really noticed a difference when we went from 60 to 90 minutes, or when I started to get the oxygen, or I was so sensitive. I was great with room air. When you gave me the oxygen, it was a little bit too much for me, and I got symptoms. And that'll change as they get better, they get more tolerant. So then we just say, okay, for you, the next number of treatments, we're going to do the time that felt the best, and room air, oxygen, whatever you're best with. As far as hard chambers and high pressure systems, like I say, we do a lot of that too. There are some people who just do better with higher pressure. My experience with long COVID, and there's 2 trials published, more coming, and I didn't review them right before because my brain was full of other stuff. But one was actually a randomized controlled trial, and it showed a lot of benefit. And these were run in the, I think, 175 to 2 atmosphere range, but they were done with no other treatment. It was just let's put them in and see what happens. What it goes to is how individual we all are. And the more, protocols are great because you have to have some boundaries, but the best thing about a medical tool like hyperbaric or anything is using the amount the person needs and not the amount you did for the last 10 people.
We're still learning. And as you said, and I want to repeat this because it's very, very important to understand that we are not using hyperbaric therapy as a monotherapy. It's not just one therapy that we're using. We usually combine it with other things that we do. And depending on how it's being combined, for example, if we combine it with other pro-oxidative therapies, such as happens in cancer world, so we need to make sure that we're not over-oxidizing and that the person has the capacity to withstand that oxidative stress, right? Or if we are combining it with other antioxidant therapies, as you said, that's a different story. And I think a patient needs a hyperbaric doctor, practitioner, or an integrative practitioner who understands hyperbaric medicine to oversee that. Because in this case, I think it's quite difficult to be your own physician. Even me being a doctor, I had a difficult time because, I cannot be objective. It's impossible. Yeah.
I would say 100%. And it's hard for people like you and me to reach out and get help from other people, but we need to. But also, there's a lot of people now that have home, low pressure chambers. And that's good, especially if they were using it prior to long COVID, for example. But we always caution them that, your body is different. If you've got long COVID, it's dealing with other things you may not have had before. So just go and see, do you really aggravate and you didn't used to? Or do you feel maybe even better? Great. Go down the road you need to. But yes, I always recommend that even if people, have access to their own hyperbaric, they work with somebody who's working on all these other areas and kind of can give you information about, okay, if you notice this with your dive treatment, your hyperbaric treatment, let's reassess something, just make some adjustments.
Absolutely. Thank you very much, Paul. It was amazing. Thank you for these insights. Thank you for all these tips on where to start, where to go, what to do, because it helps a lot. Even though the doctor is going to direct the treatment, it's always nice when a patient has an idea and participates, because that way we ensure a better result. So as always, thank you from the bottom of my heart. I know that you're really busy, and for taking your time and sharing your knowledge in this area.
I truly appreciate being asked. Thank you.
Thank you guys for listening. I hope you found this episode helpful. Please give us likes, because it really helps for other people who might need to see this information to actually see it. Subscribe to our channel to receive episodes every week. And thank you for listening. I'll see you next week.